நமக்குள்ளே தெரியும். ஓகே, உங்கள் லோகோ தெரியுதா?
Infusion of local anesthetic so that there will not be any pain even after the surgery. So previously what people used to do is they used to put an epidural and it will be there for 2-3 days. The disadvantage of that epidural is they will have both the legs weakness and they will not be able to stand, walk immediately after the surgery. And one more thing is with epidural we have to put a urinary catheter. So the chances of infection is more. So using this continuous nerve block technique we can avoid urinary catheter. The strength of this muscle will be preserved and immediately 2-3 hours after the surgery they can have the normal food. So these are all the advantages of our continuous nerve block technique and it's equivalent to the international standards what we routinely follow nowadays.
Doctor, you have any tips for giving for muscle strengthening?
Muscle strengthening, weight reduction, exercise. Only 2 things. That's it. So rest, everything, diet, all these things secondary. The regular exercise is the most important.
So it affects more for diabetes patients?
No. Diabetic patients are more prone for degeneration. It happens. It's because of they develop kind of myopathy, neuropathy, all sorts of things. So that's the reason it's much more in diabetic patients than the normal patients.
Yesterday evening, and since we have the surgical time required is very less, it's around 45 minutes, so the anesthesia which is required, the amount of anesthesia also is very less, and since the amount of anesthesia is very less, complications related to that are also very less, and patient gets back to the normal life very faster. So if the time is more, we have to give more anesthesia and the recovery will be slow. If the surgical time is less, the anesthesia required is less and the recovery will be much faster. That is the reason we are able to make the patient to stand and walk on the very same day of the surgery in the evening. And another thing is that since the surgical wound, the cut on the skin is smaller, then the muscle dissection, muscle cut what we make, that is also very less. All these things helps in the recovery. Immediately after the surgery also and long-term recovery also. And whatever exercise are there, we just try to make the patient confident enough within the first 3 days itself. So on the very first day, patient will be made to stand, walk few steps. On the next day, patient will be made to walk outside the room. On the second day after surgery, patient will be made to use the toilet. Our physiotherapist will teach them, and we will just encourage them to walk by themselves. They may require little bit of help to get out of the bed, but once they are out, they start walking on their own. And on the day of surgery, we make them to teach them to climb few steps, not full stairs, but few steps. So all these things are basically to make them confident enough, and so that once they are in the home, they can start walking on their own. They don't need any physiotherapist to go to their home and do it for months together, which used to be earlier, where the physiotherapy will go to the home and they have to do the physiotherapy on regular basis. So whatever is there, we teach them in the hospital within the 3 days and make sure that they are confident and comfortable before they get discharged from the hospital, so that they are on their own. And by this, what happens is that if the patient confidence is more and the pain is less, automatically their recovery will be much faster compared to other patients. So that is the advantage of our technique, and that is the advantage of using this thing, the gold knee implant. Thank you.
I have covered everything. Thanks for that. And now I would like to call upon these patients on stage, as Dr. MMR would like to give them token of appreciation for the efforts they have put to be here, and actually they have taken a lot of time from their busy schedule.
நல்லா கொஞ்சம் அடுத்து இல்லை They have questions to tell. Like a center. Sorry, you can speak on
Whatever implant used to be there, that was there used to live only for 10 years. Now after that, whatever regular implants we are having at present in the market, that goes maximum for 20 years. Advantage with this gold implant is that they are coated with a special material because of which it works for around 30 years. And now they have changed. One more launch is this in this polyethylene, which is ultra molecular polyethylene. They have added vitamin E inside that. So because of adding vitamin E, the life of this polyethylene is increased. So because of the life is increased, now it may work still more. So normally now we are saying 30 years. Because of this, it may work so more. So that is basically more than what the longevity. This surgery basically is done in old age. So after that, 30 to 35 years is a very long period, which is normally that is enough for our lifespan. And in the surgery, what we do is that we just make some basic cuts in the cut this bone here and make a hole inside, and the same this is the implant which is actually present. That implant will fit on this, and then so the bone which was rubbing on each other, that is replaced by metal. Both side metal will be there, and in between there will be something called as simple language poly. So what happens is that bone, if this metal rubs on each other directly, there will be small material of small metal will be released inside the joint. That we for normalize it's nothing, but in the joint that is a very big issue. And if that forms there, then the implant gets loosened, and then the problem starts. That's why if this is there, then that small material, the new with this gold knee, that material which is released inside the joint is very less. So basically loosening, and the life, that is why loosening decreases, and that is why the life increases. So what if a normal implant at present in the market works for 20 years, this will definitely work for, this works for 30 years.
35 years.
So easily that is the thing.
Thank you.
Thank you.
He's in the practice for about more than 36 years in the practice. But today is important day for us to launch a new product called, it is polyethylene, which is infused with vitamin E. So what it means is this reduces the oxidation inside the body, that reduces the friction caused by the movement inside, and the longevity of the implant is more. Previously, when we suggest operation for these patients, so we used to counsel them, this will work for about 20 years like this. Now, with this new material, that is Vitalon, so we can confidently say this will work more than 30 to 35 years. That's the biggest advantage of this material being introduced. On the last year, the same company has introduced a new product called Gold Knee. Gold in the sense, it is titanium coated with niobium oxide that gives gold color. So this also reduces the friction. So along with this gold implant and this Vitalon, vitamin E infused polyethylene, I think in my view it should last long and it should last lifetime. So this operation is meant for the lifetime operation.
அல்ட்ராசவுண்ட் மிஷின் வச்சு அந்த நீ ஜாயிண்ட்டை என்ன நர்வ் சப்ளை பண்ணுறதுங்கிறத பார்த்து அங்கே ஒரு கத்தீட்டர் மாதிரி ஒரு டியூப் மாதிரி அந்த நர்வ் கிட்ட வைப்போம். வச்சுட்டு லோக்கல் அனஸ்தட்டிக் கண்டினியூஸாக ஒரு 2-3 டேஸ் போயிட்டுருக்கோம். ஸோ சர்ஜரி முடிஞ்சோடனே இமீடியட்டாக பெயின் சுத்தமாக இருக்காது. ஸோ அந்த நீ ஜாயிண்ட்டுக்கு மேலே இருக்க மசிலோட ஸ்ட்ரென்த்தும் ப்ரிசர்வ் ஆகும். ஸோ இமீடியட்லி ஆஃப்டர் த சர்ஜரி அவங்க நடக்கலாம், நார்மல் ஃபுட் சாப்பிட்லாம். ஸோ இதுக்கு முன்னாடி எபிடியூரல் அனஸ்தீஷியான்னு கொடுப்பாங்க பெயினுக்கு. அதோட மெயின் ட்ராபேக் என்னென்னு பார்த்தீங்கன்னா காலில் வீக்னஸ் இருக்கும், அப்புறம் அவங்களால நடக்க முடியாது அந்த வீக்னஸ்னால. ஸோ நார்மல் ஃபுட்ஸ்லாம் சாப்பிட முடியாது. ஸோ நியூவர் டெக்னிக்ஸ் நம்ம ஃபாலோ பண்ணுறதுனால பெயின் வந்து ரொம்ப கம்மியாக இருக்கும், நார்மலாக நடக்கலாம், சான்சஸ் ஆஃப் இன்ஃபெக்ஷன்லாம் வந்து கம்மி. ஸோ அதுதான் பெயின் மேனேஜ்மெண்ட் பொறுத்த வரைக்கும் அந்த நீ ரீப்ளேஸ்மெண்ட் சர்ஜரிஸில்.